morning. I'm Allah, the first year medical student from Rocademia. Today we're going to talk about the effect of insulin on the cognitive function of Alzheimer's disease patients throughout a literature review. So first of all, we'll begin talking about the etiology of Alzheimer's disease and its pathogenesis. Then I'm going to mention the study objectives, the methodology, and then we're going to talk about the relation or the effect of insulin on Alzheimer's disease progression and the conclusions and the recommendations. So first of all, Alzheimer's disease was discovered in 1913, nearly a century ago, by the German psychiatrist Aldous Alzheimer's. And nowadays, Alzheimer's disease represents from 60 to 80% of the dementia found worldwide. And we can see the number of cases here was about 35 million cases in this very moment, and it's going to be about 66 million cases in 2030 and 150 million cases in 2050. So, what is the pathogenesis of Alzheimer's disease? The pathogenesis of Alzheimer's disease is not fully explained until now, but the major signs of Alzheimer's disease is the continuous neuronal loss that can be stopped and the accumulation of abnormal amyloid beta peptides and the tau tangles. So why insulin? Insulin is actually related to the glucose metabolism in the brain. And it was found that the amyloid beta accumulations that occur in the brain are related to brain insulin and insulin-like growth factor. And also, it was found that the genes that are encoding for the brain insulin, the insulin growth factors, and their receptors in the brain are diminished, are decreased in the case of Alzheimer's disease. And it was said that there's a connection between Alzheimer's disease and diabetes, so there was a hypothesis that Alzheimer's disease could be considered as diabetes mellitus type 3. So the objectives of this study is to review the effect of insulin as a treatment on the cognitive function of Alzheimer's disease patients. And so other research was done using Science Direct in the last decade for the trials that use insulin as a treatment for Alzheimer's disease, and these were the keywords that were used. Now, the insulin that was used in this kind of treatment was intranasal insulin. So why intranasal insulin? Insulin actually can be synthesized in the nasal serum glands and then is transported to the brain through the blood-brain barrier. And this barrier protects the brain and facilitates the transportation of the therapy throughout the central nervous system. And we can see here the purple proteins are actually parts of the blood-brain barrier. So the intranasal insulin was used so that it can be transported in a very efficient way to the brain. And at the same time, we have to mention that the effect of insulin is very, very obvious on the blood glucose level. So this is another reason why it's used as an intranasal spray and not as an injection, because in this case it will be mostly transported to the brain and will not affect the glucose level in the periphery. So this is these are the clinical trials, and we can find that the intranasal insulin used in the dose of 20 international units or 40 international units actually improved the cerebral glucose metabolism, and it improved the dementia scale rating, severity rating scale results, the Alzheimer's disease assessment scale cognition tests, and the Alzheimer's daily living scale tests. So it affected the cognitive function and the daily life tests of the patient. Also, we can find this here from these results and these ones too. In this recent study, another type of insulin, which is a rapid-acting insulin, was used, and it was used as a single dose, and it was used in patients with apolipoprotein E4, which is a very important risk factor of Alzheimer's disease. And when this protein was found with just a single dose of this insulin, it didn't really show any significant results. So the conclusion we can get to is that intranasal insulin administration had significant results in keeping or even improving the genetic functions of the patients relatively compared to placebo. And this will return to the rapid effect of insulin through the blood-brain barrier. And as I mentioned, Alzheimer's disease could be considered as type 3 diabetes with a neuroendocrine features. So the recommendations are further clinical trials that can be conducted, testing the intranasal insulin treatment and its efficacy, its relation, how it interacts with the brain in order to solve the puzzle of Alzheimer's disease that's not fully explained until this very moment. Thank you very much for your attention.